The human body is an amazing place. It's the largest internal organ system and has an enormous surface area. But just because we're familiar with the exterior doesn't mean we understand its full complexity. So what if a killer was hiding in plain sight inside your gut? Seldom talked about, almost always diagnosed too late. This is the story of duodenal cancer, rare, aggressive, and dangerously underestimated. By the end of this video, you'll know the warning signs, what puts you at risk, and most importantly, how to catch it early before it strikes. We'll dig into what duodenal cancer is, how it differs from other intestinal cancers, real symptoms many ignore, diagnostic breakthroughs, and new treatments that are changing outcomes. And that's not all. I have a special gift for those of you who stay until the end. So buckle up, grab some popcorn, and join us on this journey to uncover the secrets of one of the gut's most hidden dangers. Welcome back, everyone. If you're new here, welcome. I'm a board-certified diagnostic and interventional radiologist. This video series is created to help you learn about your body through the lens of radiology. If you find this video helpful, please like, comment, and subscribe so we can continue making great content. Now, let's get into the topic for today. Duodenal cancer is a rare form of malignancy that occurs in the duodenum, which is the first part of your small intestine. It's the section of the intestine located right after the stomach and before the jejunum. The main function of the duodenum is to mix digested acids, bile, and enzymes from the pancreas and other organs to further break down food. And it plays a critical role in the absorption of nutrients. To better understand this condition, let's start by defining what the duodenum is and how it functions. The small intestine is a long tube-like organ where most of the digestion and nutrient absorption takes place. It's divided into three sections: the duodenum, the jejunum, and the ileum. The duodenum is the shortest and the first section of the small intestine. It receives partially digested food or chyme from the stomach and mixes it with digestive juices from the pancreas, liver, and gallbladder. This process helps break down the food further and allows for the absorption of essential nutrients. Now let's talk about the different types of duodenal cancer. The most common type is duodenal adenocarcinoma, which accounts for approximately 1% of all gastrointestinal cancers. Other types include duodenal neuroendocrine tumors and rare types like adenosquamous carcinoma and small cell carcinoma. While duodenal cancer is relatively rare, it's crucial to be aware of the signs and symptoms. It's important to note that due to its rarity, there's limited awareness about duodenal cancer, which can lead to a lack of standardized screening protocols. This often results in late diagnosis when the cancer has already spread to other parts of the body. So what actually causes duodenal cancer? Unfortunately, the exact cause remains unknown. However, researchers have identified certain risk factors and conditions that may increase one's susceptibility to developing this disease. Genetic syndromes like familial adenomatous polyposis, FAP Lynch syndrome, Peutz-Jeghers syndrome, and others have been linked to an increased risk. Chronic conditions such as celiac disease, Crohn's disease, and long-standing gastritis may also play a role. While the evidence is still being explored, factors like diet, smoking, alcohol consumption, and obesity are believed to contribute to duodenal cancer development. As research progresses, we hope to gain a deeper understanding of the underlying causes. But what if I told you there were warning signs, symptoms that could indicate whether you were at risk without even knowing it? Let's explore some of these early indicators together. In the early stages, the symptoms of duodenal cancer tend to be vague and nonspecific, often mimicking other common digestive issues. Abdominal pain and discomfort, bloating, nausea, and loss of appetite are some of the most frequently reported symptoms. However, as the cancer progresses and starts to affect the digestive process, more noticeable signs appear. Blood in the stool or vomit, unexplained weight loss, and jaundice are common. If the tumor grows and obstructs the bile duct, these signs might manifest. Despite these symptoms, many individuals often ignore or dismiss them, assuming they're due to less severe conditions like ulcers, gallbladder problems, or gastritis. This can lead to a delay in seeking medical attention and, consequently, a late diagnosis. Let me share a case example to illustrate this point. I once saw a patient who presented with vague abdominal discomfort. At first it was mild, but gradually became more frequent and intense. He tried over-the-counter medications, thinking it was just indigestion. But as time went on, he noticed blood in his stool. Finally, after several months of these symptoms, he sought medical advice. After evaluation, including a colonoscopy, the diagnosis of duodenal cancer was made. It was at a stage where surgical intervention was no longer an option. This is unfortunately a scenario that's all too common. People often live with these symptoms for extended periods, sometimes years, before seeking medical help, and by the time a diagnosis is made, the cancer may have progressed to advanced stages. That's why it's so important to be aware of these symptoms and consult a healthcare professional promptly if you experience them. Now that we've covered some of the common symptoms, let's move on to the next step in understanding duodenal cancer. How is it diagnosed, and what does the process entail? The journey from suspecting something's wrong to getting a definitive diagnosis can be quite a ride. So let's break down the key steps involved. In the early stages, the symptoms of duodenal cancer tend to be vague and nonspecific, often mimicking other common digestive issues. Abdominal pain and discomfort, bloating, nausea, and loss of appetite are some of the most frequently reported symptoms. However, as the cancer progresses and starts to affect the digestive process, more noticeable signs appear. Blood in the stool or vomit, unexplained weight loss, and jaundice are common. If the tumor grows and obstructs the bile duct, these signs might manifest. Despite these symptoms, many individuals often ignore or dismiss them, assuming they're due to less severe conditions like ulcers, gallbladder problems, or gastritis. This can lead to a delay in seeking medical attention and consequently a late diagnosis. When it comes to diagnosing duodenal cancer, the primary tool in doctors' arsenal is endoscopy. During this procedure, a thin, flexible tube with a camera attached is inserted into the duodenum to visually inspect the lining and identify any abnormalities. Imaging techniques like computed tomography or MRI scans help visualize the tumor and determine its size and location. In some cases, a more detailed examination of the duodenum may be necessary, which can be achieved through duodenoscopy. This allows doctors to take tissue samples or perform other minimally invasive procedures if needed. It's important to note that early detection is crucial for improving outcomes. However, the subtlety of symptoms and the complexity of the digestive system can make diagnosing duodenal cancer challenging. Often there's a delay between the onset of symptoms and an accurate diagnosis. So now that we've delved into the diagnostic process, let's turn our attention to the available treatment options and the outlook for those diagnosed with duodenal cancer. The treatment plan depends on several factors, including the stage of the cancer, its size, and whether it has spread to other parts of the body. Surgery is often considered the primary treatment option, especially in the earlier stages. Procedures like local resection, the Whipple procedure, or segmental resection may be employed to remove the cancerous portion of the small intestine. These surgeries, while effective, can be complex, and their success depends on various factors such as the extent of the cancerous spread. In addition to surgery, chemotherapy and radiotherapy may be recommended, either before or after surgery, depending on the specific situation. The decision to use these treatments is individualized and often involves a multidisciplinary approach, taking into account the patient's overall health and preferences. While it's generally true that early detection and treatment are key to better outcomes, it's important to remember that every case is unique. The prognosis for duodenal cancer tends to be more guarded compared to some other types of cancer due to its aggressive nature and late presentation. Many patients are diagnosed at later stages when the cancer has spread, making treatment more complex. Survival rates vary widely depending on the stage, at diagnosis, and other factors. Despite the challenges, ongoing research offers a glimmer of hope. Studies are exploring promising avenues such as immunotherapy and targeted therapy. By understanding the genetic makeup of the cancer cells, researchers are working toward developing therapies that specifically target the cancer while minimizing harm to healthy cells. As we continue to learn more about duodenal cancer, we hope to see more targeted and effective treatment options become available. If you've stuck with us until now, you know that I have something special planned. Here it is. Are you ready? As promised, let us discuss some of the latest research findings and upcoming clinical trials that will hopefully shed more light on this rare condition. For instance, a recent study titled Advances in Diagnosis and Management of Duodenal Adenocarcinoma, published in the journal Cancers, explored the current understanding of duodenal cancer and highlighted areas for future research. Another promising development is the ongoing clinical trials focused on novel biomarkers and treatment strategies for duodenal cancer. These trials aim to identify specific molecules or genetic markers that can aid in early detection and predict the effectiveness of certain therapies. Additionally, there are trials investigating the use of targeted therapy and immunotherapy for treating this form of cancer. By staying informed about these advancements and supporting organizations that fund research, we can contribute to finding better ways to diagnose and treat duodenal cancer. Remember, knowledge is power. That's a wrap, folks. We hope you found this deep dive into duodenal cancer informative. If you've noticed any new or concerning digestive symptoms or have a family history of digestive conditions, it's time to schedule that Dr. S appointment and ask for specific tests to rule out any potential issues. Don't forget to like, comment, and subscribe for more insightful content. Until next time, stay curious and take care of your gut. It's the engine that keeps you going.